The video you are about to see is going to show people that have been harmed by fluoroquinolone antibiotics. So often, when fluoroquinolone toxicity is discussed, or the adverse effects of this class of antibiotics, it's very matter-of-fact. It doesn't really take into account the actual victims. Fluoroquinolone antibiotics come in many forms: pill, injectable, IV, eardrops, eye drops, and they carry the most serious warning from the FDA, a black box warning. The most significant in 2016, which stated that fluoroquinolone antibiotics should be used as last resort only when no other treatment options are available. And this is because fluoroquinolone antibiotics have a warning of potentially permanent and disabling side effects. People you will see in this video were not aware of the dangerous nature of these antibiotics. In fact, most people feel like antibiotics are a good thing and will cure them for whatever infection they have, not disable them and destroy their lives. This is one of the biggest reasons why we need informed consent. Informed consent would mean that the prescriber would need to discuss the risk and the adverse effects with the patient before prescribing the medication. In this case, the patient would be aware of the dangerous side effects and would be able to make an informed healthcare decision for themselves, determining if they wanted to take the risk of taking that medication or ask for a potential alternative. The reality is that there is a huge disconnect between the FDA, the medical community, and those of us that have been harmed by fluoroquinolone antibiotics. An informed consent would be one measure that could be put into place that could protect future people from being harmed. Fluoroquinolone antibiotics are not like other antibiotics. They have the most adverse effects and the most black box warnings. And if anybody watching this video doesn't think that warrants informed consent, I don't know what else would. Let's put some name and faces to those of us that have been harmed by fluoroquinolone antibiotics. It's one thing to talk about this, it's another to see it. All of these people have had their life flipped upside down after taking a fluoroquinolone antibiotic. They're all still suffering from adverse effects from one degree to another. Many have lost their careers, their independence, and most importantly, their quality of life. Now they're suffering from fluoroquinolone toxicity syndrome and have no recourse, treatment, or help for being in this situation. Please consider informed consent and sign the informed consent petition on change.org. I know that everyone that you're about to see, if they had had informed consent, they would have never taken the antibiotic that did this to them. Thanks, everybody.
Welcome to FDA Drug Safety Podcasts for healthcare professionals. This is Steve Jackson, a pharmacist from the Division of Drug Information. On July 26, 2016, FDA approved changes to the labels of fluoroquinolone antibacterial drugs for systemic use, i.e., taken by mouth or by injection. These medicines are associated with disabling and potentially permanent side effects of the tendons, muscles, joints, nerves, and central nervous system that can occur together in the same patient. As a result, we revised the box warning, FDA's strongest warning, to address these serious safety issues. We also added a new warning and updated other parts of the drug label, including the patient medication guide. We have determined that fluoroquinolone should be reserved for use in patients with no other treatment options for acute bacterial sinusitis, or ABS, acute bacterial exacerbation of chronic bronchitis, ABECB, and uncomplicated UTI, because the risks generally outweigh the benefits. For some serious bacterial infections, the benefits of fluoroquinolones outweigh the risks, and it is appropriate for them to remain available as a therapeutic option. Healthcare professionals should stop fluoroquinolone treatment immediately if a patient reports serious side effects and switch to a non-fluoroquinolone antibacterial to complete treatment. Fluoroquinolone labels already have a boxed warning for tendinitis, tendon rupture, and worsening of myasthenia gravis. The labels also include warnings about the risks of peripheral neuropathy and CNS effects. Other serious risks are described in the labels, such as cardiac, dermatologic, and hypersensitivity reactions. FDA evaluated reports of apparently healthy patients who experienced disabling and potentially permanent side effects involving 2 or more body systems after being treated with a systemic fluoroquinolone. We evaluated only reports submitted to the FDA. There are likely additional cases of which we are unaware. The side effects occurred within hours to weeks after starting the fluoroquinolone. At the time we received the reports, the side effects had continued for an average of 14 months to as long as 9 years after stopping the medicines. Several cases reported that some side effects stopped or improved after discontinuation of the medicine. Others reported that side effects worsened or continued. Side effects involving fluoroquinolones should be reported to the FDA's MedWatch program at www.fda.gov/medwatch. A link to the full communication and the complete data summary can be found at www.fda.gov/medwatch. www.fda.gov/drug safety communications. If you have drug questions, you can reach us at druginfo@fda.hhs.gov and follow us on Twitter at FDA Drug Info for up-to-the-minute important drug information. Know the moment it happens. Thank you for listening.